Christmas at the Williams family house meant maintaining appearances. Grandmother's crystal chandelier, professional photography for the holiday card, gifts arranged under the 12-foot Fraser fur like a magazine spread. Everyone dressed in their holiday best, celebrating another year of family achievement and prosperity. Everyone except me. At 29, I was the family's puzzle piece that didn't quite fit. While my cousins climbed corporate ladders in finance and law, I'd spent the last 6 years working at the county hospital emergency department. 12-hour shifts, scrubs instead of suits, a modest salary that barely covered my student loans and small apartment across town. What my family saw was their disappointment. The brilliant daughter who'd thrown away her potential on a service job, instead of pursuing something prestigious like private practice or pharmaceutical research. They'd stopped asking about my career years ago, settling into polite tolerance of my choices. What they didn't know was that Dr. Sarah Williams, the tired woman in clearance store clothes, had quietly become one of the leading researchers in emergency medicine trauma protocols. My work on rapid intervention techniques had been published in 12 peer-reviewed journals. The methodology I'd developed had reduced mortality rates by 18% across 43 hospitals nationwide. More importantly, they didn't know about the foundation. 3 years ago, I'd started the Williams Emergency Medicine Foundation with a $5,000 donation from my savings account. It began as a way to fund equipment upgrades for underfunded emergency departments, but it had grown into something revolutionary. We now operated in 37 states, providing cutting-edge medical equipment, training programs, and research funding to hospitals that couldn't afford them otherwise. Last month, we'd received a $20 million grant from the Department of Health. Our annual budget now exceeded most mid-sized hospitals. I was personally responsible for saving hundreds of lives through improved emergency care protocols. But to my family, I was just Sarah who worked at the county hospital and drove a 10-year-old Honda. Christmas morning unfolded with orchestrated precision. Cousin Michael opened his Rolex from his pharmaceutical executive wife. Cousin Jennifer admired her designer handbag from her investment banker husband. Everyone exchanged gifts that reflected their financial success and social status. Then came my turn. "Sarah, sweetheart," Aunt Patricia said with that particular smile reserved for family charity cases, "we picked out something practical for you." She handed me a gift bag from Target. Inside was a clearance rack sweater, tags still attached showing the markdown from $24.99 to $12.99. The kind of polyester blend that would pill after 2 washes. "We thought you'd appreciate something comfortable for those long hospital shifts," she said kindly. Cousin Jennifer chimed in helpfully. "It's so smart to shop clearance. Very budget conscious." Michael nodded approvingly. Nothing wrong with being practical when money's tight. The subtext was clear. "We understand you're struggling financially, so we bought you the kind of gift we imagine fits your limited budget. Walmart clothes suit your budget." Jennifer's husband David laughed, examining the clearance tag. "Good quality for the price point." Everyone chuckled politely at what they considered gentle, loving humor about my financial situation. Poor Sarah, working at the county hospital, making do with whatever she could afford. I held the sweater and smiled. "Thank you. It's very thoughtful. We just want you to know we support your choices," Aunt Patricia said warmly. "Not everyone needs to chase money and status. Service work is so important." Service work. Like I was volunteering at a soup kitchen instead of practicing emergency medicine. Uncle Robert raised his coffee mug. "To Sarah, who reminds us that success isn't always about the size of your paycheck." They were toasting my supposed failure while congratulating themselves on their enlightened acceptance of my limitations. That's when my phone started buzzing insistently. I glanced at the screen. Rebecca Chin, executive assistant. My heart rate spiked. Rebecca only called during family time if something critical was happening with the foundation. "Excuse me," I said, standing up. "I need to take this call." "Sarah," Mother said disapprovingly, "we're in the middle of gift exchange. Can't it wait?" "It'll just be a minute," I said, walking toward the kitchen. "Probably the hospital," Michael said knowingly. "They work her like a dog over there." I answered the call in Mother's pristine kitchen. "Rebecca? What's happening?" "Dr. Williams, I'm so sorry to interrupt Christmas morning, but we have an emergency board situation." The Department of Health just approved our expansion proposal for the Pediatric Trauma Initiative. My stomach dropped. Which expansion proposal? The $50 million grant for nationwide implementation. They want an emergency board meeting tonight to discuss immediate deployment strategies. All 12 board members are flying in from across the country. $50 million. For the pediatric program I'd been developing for 2 years, designed to save children's lives in rural emergency departments that lacked specialized equipment and training. Dr. Williams? Are you there? Yes, sorry. How many hospitals are we talking about? 167 pediatric emergency departments across 38 states. The implementation timeline is aggressive. They want full deployment within 18 months. I sat down heavily in Mother's breakfast nook, surrounded by her collection of expensive china, processing what this meant. The Williams Emergency Medicine Foundation was about to become one of the largest medical research and implementation organizations in the country. Rebecca, can you handle the logistics? I'm at family Christmas. Of course. But Dr. Williams, there's something else. CNN wants an exclusive interview about the expansion. They're calling it the largest federal investment in emergency pediatric care in U.S. history. National news coverage of the foundation's work, the grant, the lives we were saving. Set up the interview for tomorrow, I said. And Rebecca? Thank you for everything you do. It's an honor, Dr. Williams. Your work is changing everything. I hung up and sat in the silence of Mother's kitchen, processing what had just happened. The family was in the living room, probably still discussing my budget-friendly Christmas gifts, completely unaware that their disappointing daughter had just secured funding to revolutionize pediatric emergency medicine across the entire United States. Through the doorway, I could hear Cousin Michael explaining something about pharmaceutical profit margins to Uncle Robert. Time to rejoin my family. I returned to the living room where the conversation had moved to Jennifer's recent promotion to senior associate at her law firm and the accompanying salary increase. Everything okay? Mother asked as I sat down. Actually, I said, setting my phone on the coffee table, that was my executive assistant. We just received some significant news about the foundation. Uncle Robert looked confused. Foundation? What foundation? The Williams Emergency Medicine Foundation. The organization I established 3 years ago to improve emergency care in underfunded hospitals. The room went quiet. Michael set down his coffee cup. I'm sorry, Jennifer said carefully. Did you say your foundation? Yes. We just received approval for a $50 million federal grant to implement pediatric trauma protocols nationwide. Complete silence. Aunt Patricia's mouth opened slightly. 50 million, David repeated slowly, as in dollars? The Department of Health is funding expansion to 167 pediatric emergency departments across 38 states. Uncle Robert leaned forward. Sarah, I need to understand something. You run a medical foundation. I founded it. We've been operating for 3 years, focusing on emergency medicine research and equipment funding for underserved hospitals. Operating how? Michael asked. Like actual operations with staff and budgets? 47 full-time employees, 12 board members, annual budget of $32 million before this new grant. The numbers hit the room like physical objects. Jennifer's designer handbag slipped off her lap. $32 million budget, Mother said faintly. For your foundation. Our work has reduced emergency department mortality rates by 18% in participating hospitals. We've saved over 3,000 lives in the past 2 years. My phone rang again. I glanced at the screen and answered on speaker. Dr. Williams, this is Tom Rodriguez from CNN Medical Correspondent Team. We'd like to schedule an exclusive interview about the pediatric trauma expansion. This represents the largest federal investment in pediatric emergency care in decades. The family stared at my phone like it was speaking in foreign languages. Can we schedule for tomorrow afternoon? I asked. Perfect. Dr. Williams, our research team has been following your foundation's work. The mortality reduction statistics are unprecedented. How do you respond to colleagues calling this the most significant advancement in emergency pediatric care since the introduction of trauma centers? I think we're just getting started, I said. Every child deserves access to the best possible emergency care, regardless of their hospital's zip code or budget. Excellent. We'll see you tomorrow for the interview. I hung up and looked around at my family's stunned faces. Uncle Robert poured himself a scotch at 11 in the morning. Sarah, he said very carefully, when you said you work at the county hospital you meant. I'm the attending physician in emergency medicine. But I also founded and run the Williams Emergency Medicine Foundation. The foundation that just received $50 million from the federal government, Jennifer said numbly. For pediatric trauma protocols, yes. Michael had gone completely pale. Sarah, how is this possible? We thought you were just working shifts. I am working shifts. 60 hours a week in the emergency department, plus another 40 hours running the foundation. 100 hours a week? Aunt Patricia whispered. Emergency medicine doesn't stop for holidays or convenient schedules. Mother set down her coffee with shaking hands. Sarah, why didn't you tell us about any of this? Would it have changed how you treated me? The question hung in the air like smoke. Because we all knew the answer. Yes, it absolutely would have changed everything. They would have asked about my work differently, respected my schedule, included me in conversations about professional achievements and long-term impact. But they would have changed their behavior because of prestige and recognition, not because I deserved basic respect as someone working to save lives. We always respected your work, Uncle Robert said weakly. You bought me a clearance sweater and joked about my budget 5 minutes ago, I said gently. His face reddened. I didn't realize the scope of your responsibilities. You didn't realize because you assumed. You saw the hospital job and decided what my life looked like without asking questions. My phone buzzed with another call. The Department of Health. I should take this, I said. The pediatric program implementation requires immediate coordination. Through the living room windows, I could see neighbors walking past with their own Christmas morning activities, completely unaware that one of the most significant advances in pediatric emergency medicine had just been approved inside this suburban house. There's going to be a press conference, I said, ending the call. Tomorrow at the Department of Health. The Secretary of Health wants to announce the pediatric initiative personally. A press conference, Mother repeated faintly. With the Secretary of Health. About your foundation. About saving children's lives in emergency situations, yes. The family dynamic has shifted permanently. I'm no longer the disappointing daughter who chose service over success. Mother brags to her bridge club about her medical foundation executive daughter. Uncle Robert asks my opinion on healthcare policy. The cousins want to discuss their own charitable giving strategies. I still work 60-hour weeks in the emergency department, still drive my Honda, still live in my modest apartment. The foundation work has expanded beyond anything I imagined possible, but the core mission remains the same, ensuring every patient receives the best possible emergency care. The clearance sweater sits unworn in my closet, a reminder that respect should never require press conferences to earn. The people who knew my worth before they knew my recognition. My colleagues in the emergency department, the nurses who work alongside me, the patients whose lives we've saved together, they're still the same. Because genuine respect isn't built on grant announcements or news coverage. Mother called about Easter plans last week. No mention of budget-friendly gifts or service work limitations. Some lessons take time to stick, but they do stick eventually. Even for families who mistake quiet dedication for lack of ambition. The pediatric trauma protocols are now active in 167 hospitals. Last month alone, we saved 43 children's lives through improved emergency care procedures. That's worth more than all the designer handbags in the world.